Hello everyone, my name is Mami Isiteria and I am an applied health student at Brigham Young University, Idaho. Today I'll be sharing with you a workshop on sexual health education. So we'll be moving to my first slide, which is the topic and outlines the various questions. Why sexual health and is a major health educative program? The potential, priority, target, and influencing audience in this issue, the need to use protection in having sexual intercourse, the outlining dangers and diseases in this, the various communication channels which will help spread the information. Now let's move to my second slide, which is the learning outcomes. By the end of this workshop, participants will understand why sexual health education is important, the objective for this workshop, the audience appropriate for this education or message, various organizations which will help implement and educate the nation, especially the youth, how to create an awareness or spread the message. Now let's move to my third slide, which is why sexual health education is important. Sexual health is one of the major health educative programs that needs to be taught and enlightened to the public in order to at least reduce the number of lives killed either directly or indirectly by practicing unsafe sex. According to the International Journal of Sexual Health, WHO, sexual health addresses the reproductive processes, functions, and systems at all stages of life, which implies that people should have a responsible but not forceful, satisfying by creating awareness of both partners, healthy reproductive system, safer sex life, and the freedom to decide if, when, and how often to do so. We continue. It is one of the major health educative programs that needs to be taught and enlightened, especially among young adults. When the public, specifically the teens and the nation as a whole, is being educated thoroughly on the principles and concepts based on sexual health in addressing the reproductive processes, functions, and systems at all stages of life, it will really help in at least reducing the number of lives killed either directly or indirectly by the practice of unsafe sex. Now we move to the main objective for this workshop. This workshop objective is to remind the youth, especially the young teens, on how needful it is to abstain from unprotected sex, either with their partners or anyone whom they've been practicing sexual intercourse with. I also want to create an awareness of how risky and dangerous it is to have a sexual affair without protection, because it sometimes leads to unwanted pregnancy, abortion, and death to its highest limits. Now let's move to the sixth slide, which is the audiences appropriate for this message. Now, the potential audience can also be said to be the same young female adults or teenagers, but specifically the babies who are killed either directly or indirectly as a result of abortion by practicing unsafe sex. These harlots dress to expose their inner and private parts with the intention to seduce men and young male adults to get what they want, that is money from them. Some people now practice that as their profession, called prostitution, all in the name of wealth and possession, and the young male adults and men also engage themselves in this act with the intention of getting sexual satisfaction with them. I continue. The influencing audience discussed here are the health ministry along with all the councils with other stakeholders, and they are in the rightful position to put a stop to these practices. The key influencers are both the governmental and private personnel who sees to it that these practices are put to stop. Young adults, specifically teenagers, both male and female, are my target audience with whom I want to reach my communication with. These teenagers are the future leaders of the country and the world as a whole, and they see themselves as a grown adult who do not take full responsibility of their actions taken outwardly due to fear, ignorance, and carelessness at some point in time. Most of these adolescents aspire to hold higher positions in life at both the government and private institutions and agencies, while others also prefer to be entrepreneurs and train others. Parents, health practitioners, and religious council leaders are both the primary and the secondary influencing audiences appropriate to these adolescents. Now we move to the eighth slide, which outlines the various organizations which will help implement the message. The type of organization I feel would best develop and implement this message is the Ministry of Health and Ghana Health Service. According to the Ministry of Health in 7/8 population, is to formulate health policy, set standards for the delivery of healthcare in the country, and provide strategic direction for health delivery services. According to the Ghana Health Service, is to promote healthy mode of living and good health habits, establish effective mechanism for disease surveillance, prevention of control, provide in-service training and continuing education. Now we move to the ninth slide, which is how to create an awareness or spread the message. The health ministry, along with all the councils in the country, that's the Christian, Islamic, and traditional with other stakeholders, are the facilitators who can help put a stop to these practices. Since most people practice this because of lack of employment avenues, the government must rise with the sole purpose of demolishing this act and create more job opportunities, at least for these people and other more, to help put a stop to it. In fact, I will employ all the possible best communication channels in the country to help put a stop to this by abstaining from unprotected sex, which includes television stations, radio stations, print ads, point of purchase materials, promotional giveaways, earned media, and all the social media handles. By involving all these breasts, it will really help carry the information so easily and faster across the nation and worldwide, which will help meet our priority goal and need in this particular issue. My audience is most open in getting these messages on the day the world celebrates its Sexual Health Day. This day helps most individuals, not only the teenagers alone, but also the entire nation, to know how needful it is to abstain from unprotected sex and also in taking good care of their sexual health. Writers and designers should at least focus more on these concepts, explaining how needful it is for individuals, specifically young adults, both male and female, to take good care of their sexual health and also to abstain from unprotected sex, outlining the dangers and risks it has as effects, and the communication must be tailored to a low literate audience in order to make them understand so easy and faster. Thank you for taking time to follow through to the end. Thank you all.